Hey there. About a dozen years ago, Nicole Wipp was trying to spend less time running her law firm and more time with her son, who was in preschool. It was a work in progress. And then she started feeling a little off, tired, out of breath. Her doctor thought it was stress, and Nicole didn't think so, but she just soldiered on and got worse for months until one day when she told her husband she just couldn't get off the couch. He was like, "You're going to urgent care." And there, an x-ray showed her whole left lung, like totally blacked out. Next stop, emergency room.
They put a huge needle and shoved it into my back and drew out 2 liters. Imagine a whole 2 liter of pop, as I'm from Michigan, so I say pop, from your body. They drew a whole 2 liter of liquid, and I felt so much better immediately. I was like, wow, I can breathe. Like, wow, this is so cool. But it was sort of horrifying.
Nicole says she eventually got diagnosed with a rare lung condition.
It's called lymphangioliomyomatosis, LAM for short.
But not before she'd spent a month in hospitals, plural, and had multiple expensive surgeries.
Minimum, my husband and I tried to tally it all up, look at all the bills afterward, and it was minimum $500,000.
Which, because her husband's job at the time provided good health insurance, didn't break them. Nicole's condition hasn't bothered her for years, but it's not cured. It's incurable. And yet, this year, Nicole and her husband didn't sign up for health insurance. For more than 20 million people on Obamacare plans, the price of health insurance changed dramatically this year. Premiums skyrocketed at exactly the same time that subsidies got sharply reduced. So some people faced horrifically stark new circumstances, like people who needed insurance to cover ongoing treatment, for cancer, for diabetes, whatever. Treatment they literally could not live without. Saw premiums jump by thousands of dollars a month, more than they could possibly afford. And millions more got stuck taking gambles, making messy, unsatisfying choices. Our partners at KFF Health News have been talking with lots of those people. They introduced us to Nicole. And Nicole and her husband could have paid for health insurance, but when rates went up, they did the math and decided not to. They're generally healthy and honestly have more financial cushion than most people. So if they need medical care, like ordinary medical care anyway, they think they'll be better off just paying cash. But they know they're gambling. They're gambling that 2026 won't be the year Nicole's condition flares up or that some other catastrophe hits. Our pals at KFF Health News also introduced us to this man.
My name's Noah Hulsman. I own and operate home skateboard shop here in Louisville, Kentucky.
It's Louisville's only skateboard shop. It's kind of a family business, kind of a community center, and kind of a place Noah has spent most of his 37 years. Noah is still paying for insurance. He's paying for protection against catastrophe. But because all he can afford this year is a bare bones plan, he doesn't have a way to pay for ordinary medical care, which he could actually really use.
So I'm kind of in a position right now. I need my left shoulder looked at, but I have an $8,400 deductible.
Oh my God.
Yeah.
So we'll get into that. I mean, it sucks. But first, I really want you to hear about this skateboard shop.
When I tell the story, it almost seems like a movie or something, like somebody made this up.
Okay, let's go. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter and I like a challenge. So the job we've chosen here on this show is to take one of the most enraging, terrifying, depressing parts of American life and bring you something entertaining, empowering, and useful. And here is how Noah ended up a skater for life.
So my grandmother, she opened up a skateboard shop in 1988 here in Louisville. It was called Skateboards Unlimited. She had a little skate park also behind it called Audubon Skate Park.
Noah's grandmother was not a skater. She'd been a nurse, but she had 5 kids, and Noah says she ended up more of a stay-at-home mom.
And then with all the commotion that was always occurring, with all the friends in and out of the house, with having 5 kids, and all these skateboarders that just started popping up, she just decided, you know what? Let's have a place for you all to go.
So she opened Skateboards Unlimited and the skate park behind it. And after a few years, when her youngest son finished high school and moved to the West Coast as a professional skateboarder, it was the end of an era and the beginning of another. Noah's grandma closed up Skateboards Unlimited.
That's when one of her employees was like, you know what? We got to keep having a skate shop.
So they opened one up and called it Home Skate Shop. Noah became a regular customer, eventually an employee, and 10 years ago, when he was 27, he took over the business. Noah is as invested as anybody could possibly be.
It's everything. It's my whole life, yeah.
And it's doing okay. There were a few rocky years early on. Noah says he qualified for Medicaid, but then things actually picked up when the pandemic started.
Skateboarding was one of the only things that you do by yourself. You're doing it outside. If I would have been able to get a hold of more product, we would have killed it.
Noah got on an Obamacare plan, and he even bought a building. The skate shop's in it, and so are some apartments. He leases out 2 of them, runs an Airbnb in a 3rd one, and he says he breaks even on it. I mean, for now.
They say, real estate is a long-term game.
And Noah is a long-term kind of guy. He and his girlfriend have been together for 16 years, even while she was away at veterinary school.
She just finished up at Auburn this past year and moved back home. And yeah, it's been awesome.
And now they live together with their 4 cats in an apartment less than a mile from where Noah's grandma started her skate shop. But it's not a cushy living. Noah says he takes odd jobs and gives skateboarding lessons to make ends meet.
Every single day is a hustle.
Oh my God.
There is no day, you can't get sick. You can't no downtime. If you take vacations, you're still working from your phone. You're checking in on the shop.
And Noah says his income, all in, has been holding steady at around $33,000 a year. So last year, with a subsidy, he was able to get a gold plan for about $105 a month. For 2026, with premiums jacked up and subsidies cranked down, that gold plan would have cost him an extra $500 a month. That is $6,000 a year, way more than he could afford. Instead, he picked a bronze plan, and it leaves him paying pretty much exactly the same every month as he did last year, but it covers so much less.
I don't even know why I'm paying that. It's useless, really, unless I get into a car accident and I have $10,000 plus worth of bills.
Or a skateboarding accident, or serious illness. Anything. Noah is holding on to that plan as a backstop against a worst case scenario, against ending up with more debt than he could ever pay back. But having a backstop is not the same as having access to medical care. A few months ago, Noah says his left shoulder started bothering him. He says it doesn't stop him from doing day-to-day stuff like running the shop, but it does impose limits.
It's those quick movements. It's those blast off times, like when I'm popping on my skateboard or when I'm turning a certain front side and throwing all my weight that way.
Yeah, and his bronze plan with its $8,400 deductible means he can't afford to even get it checked out.
To go through, the first you have to go see primary care. Then they got to do the x-ray. Then once you see the x-ray, we can't tell anything from the x-ray. Yeah, we know because it's ligaments and tendons and muscles and things. I'm not a doctor, but I've been through this a few times. So, we're going to get you the MRI. All right, here's the MRI. None of that's going to be covered.
And it sounds like thousands of dollars to Noah. I mean, to me too, honestly. And that's before getting it treated, which could really mean surgery. And Noah doesn't have thousands of dollars lying around. I mean, if he did, he would have paid up for the gold plan. So, for now, he's just avoiding tricks that could irritate the shoulder.
I can still skateboard. I just have to choose what tricks or what obstacles. I don't have the freedom that I had when I used to ride my skateboard.
And he's hoping he can nurse the injury along this way till next year when he thinks he might be able to afford better insurance.
What I'm kind of planning on doing is my shop vehicle is about to be paid off next year, or like at the, I think it's like middle of next year. And that payment is basically what that gold plan payment is.
Yeah.
And that's what's probably going to happen.
Yeah.
That's my new car payment. New shoulder payment.
Man, that super sucks. I mean, grimly hilarious.
Yeah. I mean, you have to just laugh at how ridiculous the world is these days. If you just take it serious, doom and gloom all the time, you're not gonna make it. You got to just laugh these days. It's so ridiculous.
It is. And Noah is far from alone. A Gallup poll taken in late 2025 found that more than a quarter of all Americans had postponed surgery or medical treatment because of cost. Being insured and having access to medical care, for lots of people, they haven't been the same thing for a long time. And this year, especially for people using Obamacare, that's accelerating. We don't know yet how many people made choices like Noah's and moved to plans that cover less in order to have a monthly payment they could kind of afford. Federal numbers won't be out for a while, but an analyst named Charles Gaba ran some preliminary numbers from a few states, and he found that the number of people in silver and gold and platinum plans was down significantly, and the number of people in bronze plans, the cheapest, that number was up dramatically. And we do know that at least 1 million people have dropped Obamacare. Some have dropped insurance altogether, including, of course, Nicole Wipp. We're coming back to her story. That's just ahead. This episode of An Arm and a Leg is produced in partnership with KFF Health News. That's a nonprofit newsroom reporting on health issues in America. The reporters at KFF Health News do amazing work. They win all kinds of awards every year. And in a little while, you're going to meet the KFF reporter who introduced me to Noah Hulsman and Nicole Wipp. Before Nicole Wipp knew that her Obamacare rates were going to be going up, she knew she was pissed at what she calls the insurance industrial complex.
So my son, just for example, we took him, called in advance, do you take our insurance? Took him to get basic well-child vaccines. Well, next thing I know, I got a bill for $4,000. And I called them up and I was like, what is this?
She says that was early 2025, and she's been fighting ever since.
They've cut it down to like $1,200, but I'm like, no. It should be 100% covered under our insurance. So that's the thing is like, why would I participate in this?
And at least since her $500,000 medical adventure, Nicole Wipp has been pretty determined to live life on her own terms. Even before her illness, she'd already been trying to spend less time running her law practice, more time with her family. And then, after the illness, she more than doubled down on that. On her website, she says she went from working 80 hours a week to working just 5 days a month. That's a website for a business she started after her recovery, a consulting and coaching practice that offers to help people achieve financial success on their own terms.
Financial success for me is very much not just about money. It's really more about quality of life and having enough money to have that quality of life.
So, for instance, about 4 years after her illness, Nicole's family moved from Michigan to Hawaii.
We said, we want to live in Hawaii because we want to have a quality of life. And of course, living in Hawaii is not cheap. It's one of the most expensive places in the United States to live.
But that's what they really wanted, and they made it work. And then their son got into polo, like with horses, which is harder to do in Hawaii, to do seriously, competitively, not without a lot of traveling to the mainland. So they moved again to South Carolina.
And we did, by the way, when we moved back to the mainland, FedExed 4 horses.
Oh my God.
From Hawaii to where we live now.
Oh my God.
But I know. And like when you say all these things, it sounds insane, right? It is insane.
And since then, she says they picked up another 4 horses.
So now we have a total of 8, which is a lot, by the way. And so, I say it out loud and I'm like, oh, I'm not proud of this, to be honest with you. But we have also, though, made other choices. Like, we live in a smaller home than we would otherwise so that we can do that.
And that home is in a part of South Carolina where houses aren't super expensive. So Nicole says the mortgage on their house is less than the $1,400 a month they would have been paying if they'd kept their health insurance this year. So the expensive horses, the less expensive home.
Like, these are choices that we've made it as a family that I understand very much that most people would never make these choices. But we're doing it in as responsible of a fashion as we possibly can.
Now, a few years ago, Nicole's husband changed careers. No more job-based health coverage. They started buying insurance on the Obamacare exchange. But by mid-2025, it started looking like that insurance could get a lot more expensive. Not because they would lose a subsidy. They hadn't qualified for a subsidy to start with. But if subsidies went away, she figured rates were going to go way up.
I started bringing it up to my husband. Like, I don't know what this is going to look like. I'm very worried about it. And we may be in a situation where we need to make a choice.
Like, could they contemplate doing without insurance?
And so we had probably, 20 conversations at least about it.
Now, before making a decision, even before 2026 rates got posted, Nicole and her husband started taking some steps. She scheduled a colonoscopy and went to the dermatologist for a skin check. And her husband got some tests too. Because if they weren't going to have insurance in the next year, those tests wouldn't be covered. And if any of those tests came back with scary results, insurance was going to be a lot more important. Obamacare premiums for 2026 got published. Their family's rate was going to go up by about 50%.
Once the numbers came out, I was like, I just don't know if this makes sense. But we were like, okay, we need to gather more information. We need to think about it some more.
And their tests had come back okay. They felt fine. Maybe they wouldn't need any medical care in 2026, or, not much. But maybe they would. How might they pay the bills? They kept talking, and they identified some ideas. For one thing, Nicole found some money socked away in a health savings account from her husband's old job.
It's not a lot, but it was like, oh, that's a nice little cushion. Like, we could use that if we needed.
And Nicole figured if they were paying cash, she would be in a good position to negotiate with providers for discounts.
Because I'm a lawyer. I've been around the block on these things. So I had a lot of faith that I could negotiate a bill.
And she had other ideas for finding deals.
I was like, depending on what the situation is, we could fly to another country, receive health care, quality health care, and it still would be less. And I am not above doing that.
And if all of that required more cash than they had lying around, Nicole figured, they still had some options.
We have certain assets that in a extreme emergency, we could, because it's not just the horses. We have horse trailers and there's a lot that goes along with all of that. That isn't just the horses, by the way.
None of which made their decision easy. Nicole says she and her husband didn't fully decide till the actual deadline came for signing up. And even then, they knew they were going to keep their son insured.
I would be, my opinion, not responsible mom. So because he does play a very dangerous sport.
But for the adults, they weighed the risks and they decided to gamble.
If I take that money and invest it instead of putting in, I don't know, am I going to be out further ahead? I will if I don't have a massive emergency and a $500,000 illness, right? And so it's a gamble, right? All of this is a gamble, but it was a gamble that I was like, I just don't want to participate in this any longer because this is not workable for almost anybody, but it certainly isn't workable for me anymore, mentally or emotionally.
Not workable for almost anybody.
I also think of this as a reporter. So we have these individual stories. What do they mean? First of all, why is the system like this? And what does it mean for everyone?
That's Renu Ryasam. She's a senior correspondent with our partners at KFF Health News. Renu introduced me to Nicole and Noah because she and her colleagues have been talking with dozens of people about the choices they've been forced to make about insurance this year. And thinking about what those individual stories mean has led Renu to some big reflections.
I think sometimes in the U.S. you take for granted the way things are. Just you don't realize there is another way.
Mm-hmm.
There is another way, and that's where like everybody has health insurance, and those costs are better spread out.
And Renu is speaking in part from experience. She spent half a dozen years living in Germany. So we talked about that experience and how it affects the way she sees stories like Nicole's and Noah's.
Well, first of all, it was kind of amazing to like never get a medical bill. Like that was like so mind-blowing that you just like you go to the doctor and you never get a bill.
Not because the government pays for healthcare, but because the government requires everybody to have health insurance.
People pay premiums. I mean, you have to pay into the system, and it's not necessarily cheap either. But then on the back end, you're never worried about my shoulders hurt. I have to get this MRI and I'm going to get a bill.
Most people in Germany pay a government set rate, about 15% of their income. Most insurance funds are nonprofit. Everything is highly regulated and everybody gets the same benefits. Here, things are more chaotic, less predictable. People have to make hard choices, and those choices feed back into the chaos.
So if somebody like Nicole opts out of health insurance, they're not paying into the system. And the people who are paying into the system are people who need care. And so that makes health insurance more expensive generally.
Because insurers set their rates based on how much they expect to pay out. So when healthy people bail, the rates go up. And when rates go up, healthy people bail. Those things reinforce each other. It's what experts call a death spiral. And as some of those experts told Renu, a version of that has been happening over the last year. It was not a coincidence that insurers jacked up prices when subsidies were on the chopping block.
Part of the reason that insurers raised their prices was because they expected people to drop plans and that fewer people would be paying their premiums and be paying into the system.
And people like Nicole and Noah ended up with lousy choices to make. Noah chose to keep paying for insurance as a backstop against absolute financial catastrophe, even though the insurance he can afford doesn't give him access to medical care he actually needs. Nicole and her husband, they think they've got the resources to pay for ordinary medical care, even maybe a big medical deal as long as there's time to hop on a plane and get to a country where they could afford treatment. But they're not protected against the worst. Nicole knows. Bankruptcy is a real possibility.
We don't have a guarantee, and it still weighs on me every day that I made this choice because it feels fraught. Do I regret it? No, not at the moment. I don't. Will I regret it? I hope not. I don't know, though.
Yeah. You're not like, I did it. I'm free. This is the best. It's like, no, you're not free of it.
No, I don't feel free at all.
I wish I had a snappier ending to this story. We are more stuck than ever, all of us, making messy choices, hoping for the best. So, I'm going to give Noah the last word here. He is taking his own advice, taking things as they come, recognizing what's ridiculous, and aiming to hang in there for the long term.
Hopefully we, get enough equity in this building that once it's time to pass the skateboard shop on, maybe sell the building, and hopefully that's when we get to maybe cash out and go to the beach.
Wow.
Maybe. Or maybe I'll just get to pay off my medical debt that I've accrued over however many years at that point.
Oh, man. We'll be back in a few weeks with a new episode. Till then, take care of yourself. This episode of An Arm and a Leg was produced by me, Dan Weissman, with help from Emily Pisacreta and edited by Ellen Weiss. Adam Raimunda is our audio wizard. Our music is by Dave Weiner and Blue Dot Sessions. Claire Davenport is our engagement producer. Sarah Balama is our operations manager. Bea Bosco is our consulting director of operations. An Arm and a Leg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF. That's an independent source of health policy research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He's editorial liaison to this show. And Arm and a Leg is distributed by KUOW, Seattle's NPR news station. Big thanks to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. Finally, thank you to everybody who supports this show financially. You can join in anytime at armandalegshow.com/support. Thank you. And thanks for listening.